Your health transfers over into other parts of your life. If you're sick, you can't go to work, so in terms of the economy, so it's kind of a ripple effect.
These medical inequities are complicated by daunting and convoluted approaches to health insurance.
I have a slight heart murmur, and so it led to me being categorized as uninsurable. I ended up having to pay $800 a month, and with a $6,000 deductible, $3,000 for me and $3,000 for my children. Just the weight of premium and deductible. We have this dark cloud overhead. Pastor is a trusted voice, and so that's why I'm stepping forward. That's why I'm basically sharing my story. And being a pastor, you see what happens to a lot of people who are not insured, young people and old people. Young people are really not thinking through just how important healthcare is and living a healthy lifestyle is.
Healthcare concerns may be far from the minds of many millennials, but feeling invincible can keep some young adults from considering healthcare options.
My generation and the generation after me being accountable to making sure that we are engaging.
We want to know the nuts and bolts behind this. I'm an active member with the Temple of Hip Hop, which is KRS-One's organization.
You gotta keep doing this, yo, K, we're pursuing this.
I'm one of the official hip-hop cultural specialists that have been directly guided and taught by KRS-One as well as Ministers in Aru. What I do is just looking at everything through a hip-hop lens. I mean, in essence, hip is a form of knowledge. To be hip is to be updated and relevant. Hop is a movement. So hip-hop, in essence, is about intelligent movement. And so we're not just going to blindly follow just because the masses say, hey, go sign up for health care.
Exclusion, discrimination, and the historic trauma that follows have created barriers to black participation in these systems.
Over 200 years of a sort of hesitation towards the government structures and institutions and corporate structures and institutions. So there's a lot of, we don't want to go to the doctor because we don't trust you.
And I think that definitely goes back towards, of course, the Tuskegee experiment. The healthcare system itself, it has created some distrust, and I definitely do understand that.
My parents grew up in the Deep South in Jackson, Mississippi. When my mother had a toothache, of course, they could not go in the front door. They had to go to the back door. They wouldn't actually feel your tooth. They would actually pull them.